Welcome to the press briefing. With us today, we have Dr. Albert Au, Principal Medical and Health Officer from Communicable Disease Branch of Center for Health Protection, and Dr. Lau Kai-hin, Chief Manager of Hospital Authority. The two doctors are going to give us an update of COVID-19 in Hong Kong. Dr. Lau. Good afternoon. I'd like to give you an update of the situation with HA. We have 1,813 inpatients with COVID. Among them, 254 are newly confirmed cases. For those requiring isolation facilities, 516 are in isolation wards, 122 in Tier 2 isolation wards, 556 in Infection Control Center North Lantau Hospital. Among them, 202 are newly confirmed cases. Yesterday, we reported 4 more critical cases, 4 with serious conditions. For those inpatient, so we have 27 critical cases, 26 in serious condition, and 9 are receiving treatment in ICU. Referring to the boy treated in Princess Margaret Hospital, I mentioned 4 cases of in critical condition, and the boy is among them. As announced yesterday, is a boy 2 years and 3 months old, and because of croup, he requires intubation and on aspirator and being treated in ICU. His condition is now improving. He doesn't need an intubation anymore, and he can breathe on his own. So his situation has changed from critical to stable. To play safe, he is still in the pediatrics ICU, and our medical staff will continue to monitor his situation. Now I'd like to turn to the situation in Two Moon Hospital. The 5 years, 9 months girl there, she is still in critical condition and being treated in pediatrics ICU, and will monitor her situation and provide the appropriate treatment. Her 11-year-old elder sister is still being treated in the pediatrics ward of Two Moon Hospital in stable condition. As regards cases of death, we have newly reported 10 cases of death, 6 male and 4 female aged between 60 and 97. 2 of them are from care homes. Among the 10, 7, that is 70% of them, have not been fully vaccinated. They have not received 3 jabs of vaccines. I'd like to highlight a few cases to you. The youngest one, a 60-year-old patient, male. He has lung cancer and receiving chemotherapy. On the 11th of August, he tested positive through RAT at home. He had cough and phlegm and slight difficulty in breathing. But then he did not report his condition to the Department of Health. He did not seek medical help, and then he was not on medication. His situation worsened, and then on the 14th, he attended the A&E department of our Northern Hospital. There he told the doctor that in the past few days, in the past 5 days, starting from the 11th of August, he has been having shortness of breath, phlegm, and also increased heartbeat. Now, because he was a lung cancer patient on chemotherapy, he was admitted, unfortunately, because of his lung cancer and COVID. On the same day, he passed away on the 14th. Now, I'd like to appeal to the public. This patient was on chemotherapy, so he was originally immunocompromised. and because of COVID. Now, we hope that if you are positive COVID, you should see a doctor as soon as possible so that you can be administered COVID oral drug to reduce possibility of complications and even fatality. So if you're over 60, whether you are vaccinated or not, so long as you test positive, you should see a doctor at our designated clinic or use our telemedicine medical consultation services, or you can consult a GP that can prescribe oral COVID drug. No matter whether you have symptoms or not, because the symptoms may be mild, we'll still prescribe COVID and oral drugs. There are 3 patients I'd like to mention to you as well. An 88-year-old female. She had different chronic illnesses, diabetes and hypertension, history of a stroke, and also hyperlipidemia. On the 23rd of July, she tested positive through RAT. She was prescribed COVID oral drugs. And then on the 2nd of August, she became negative through RAT, but she still had some discomfort, including fever and cough. And then on the 5th, she went to see a GP because of the symptoms I mentioned. Her CT value was still 27, and so she was referred to our A&E department. I think she went to the A&E department of Rottenji Hospital because of her condition and shortness of breath and asphyxia. She was admitted. And then COVID oral drugs were again prescribed. However, her condition deteriorated, and she passed away, unfortunately, on the 15th of August. Again, we'd like to say this to the public. Even though you might have taken COVID oral drugs, and there might be slight improvement in symptoms, but then there may be sustained coughing and phlegm. So you should see a doctor as soon as possible, because we don't know whether there are other problems other than COVID and whether other medication can be prescribed, and early hospitalization may help. Now, we keep appealing to the public to take COVID oral drugs. Don't think that with COVID oral drugs you can safely stay at home. You should continue to monitor your oxygen saturation level and also your symptoms. If need be, you should seek help at our A&E departments. And then the next patient is a 97-year-old male with some underlying diseases. He had skin cancer, and he had received operation. On the 1st of August, he tested positive by RAT again. He did not seek medical help at once. Perhaps he felt that he was fine. He felt that he was all right. However, on the 4th of August, he attended a designated clinic where he was found to have coughs and also phlegm, and he started to have some heart failure. And then we called the ambulance at the clinic, and he was sent to the Eastern Hospital. There, different medications were given, including remdesivir, and then we suspected that he might be suffering from bacterial pneumonia.
On the 15th, he passed away, unfortunately. Now you can see that at the beginning when there weren't too many symptoms or you are not feeling unwell, he was 97-year-old and he had a history of cancer. One should seek medical consultation as early as possible, even if there is no symptom. If a patient is old, we will prescribe anti-COVID drug, oral drug. And finally, a female 96-year-old. The X-ray film displayed symptoms of lung cancer. She didn't have any vaccination against COVID. Had breathing difficulties. She went to A&E department. Since she wasn't vaccinated, she had breathing problem, and the X-ray images had suspicion of display suspicion of lung cancer. The blood oxygen level was low. We immediately prescribed oral drug to her. But she was old, 96-year-old, and her lung might have lung cancer, and there was hypertension, so she passed away on the 15th of August. As seen from this case, vaccination is very important. The elderly lady didn't have any vaccination. Vaccination might have helped her. She might have antibodies, and the situation might not deteriorate so quickly. Many cancer patients, those who are chronically ill, they feel that they are ill and therefore having vaccination may harm their health. That's not correct. On the contrary, they need the protection of vaccine the most. They need the antibodies, they need the immune system to fight COVID. If they contracted COVID, their bodies can respond, and that might reduce the rate of the risk of death. The remaining 6 were chronically ill chronic patients. Some had cancer history, some had hypertension, some had a history of stroke, kidney disease. They were chronically ill, they were old, and these might be the reasons contributing to their deaths. And I also like to share with you the following. We've seen that with the increase in number of cases being admitted in a week, more than 200 new cases in a row. This is high rate of increase, and we are worried that the number of admissions will increase, and that will create a heavier burden on hospital beds and also our manpower situation, and emergency service may be affected further and may have to be reduced. If the epidemic situation deteriorates, we will have the third phase, and there will be about 2,500 to 5,000 beds reserved for confirmed COVID patients. So I urge members of the public, they should report if they are confirmed to have COVID. Whether you have symptom or not, you need to seek medical help. You need to go to the doctor, even if you don't have symptoms. If you're old, we will prescribe COVID drug to you, and you will be given the prescription. Yesterday, 209 patients recovered, 176 were discharged, 6 patients were screened, admission and confirmed, and 12 patients in the same wards were close contacts. Among staff, 110 confirmed new cases, 34 colleagues have returned to their post. About 1,100 staff members are confirmed COVID or patients or close contacts, and therefore they are still on leave. I urge our colleagues to be on guard and have all the protective measures adequately done to prevent infection. And I want to also share with you two groups. One, in the Treatment Hospital oncological ward, a clinical oncological ward, one patient assistant confirmed COVID on the 18th of August, on the 11th of August in the palliative ward. And then further tracing, 9 patients 45 to 87 years old and 4 staff members were confirmed, 7 males and 2 females, and they are now being isolated. These 9 patients, one of the 9 patients, 53-year-old male patient, because of his own illness, is classified as critical, and another 76 male patient is also critical, is also classified as serious because of his own medical underlying condition. So altogether, 1 critical and 2 serious and 6 stable. The infection control group is now investigating the situation, and patients and staff members are receiving tests against COVID. In Eastern Hospital Medical Ward, the Pamela Yeo Nadeso Hospital, in a clinical ward, in an internal medicine medical ward, a patient was screened positive on the 13th of August upon admission. After confirmation, contact tracing was conducted. 6 patients, 67 years old to 95 years old, were confirmed, and 1 staff member was confirmed. They are now in the isolation ward. They are in stable condition. All the patients and staff members of the hospital will be tested. The medical ward has suspended admission and also any visitation. And it is thoroughly disinfected, and we will monitor the situation very closely and keep in contact with the DH. So much from the hospital. Thank you, Dr. Lau. I will speak on the number of confirmed cases. Yesterday, locally confirmed cases, 4,890, among which 1,734 were confirmed by PCR test, 3,156 confirmed RAT, afterwards confirmed by PCR. Yesterday, we received 272 imported cases, 246 confirmed by PCR test, and 26 confirmed by RAT. As the number of deaths, Dr. Lau has spoken on that. Reported by the HA, number of death cases, 10. We also received 1 case from the forensic expert. An 86-year-old male had 1 dose. He didn't have any chronic illness. He suffered from a hip joint fracture. He was bedridden. On the 4th of August, he was found in a coma at home, and when the ambulance man arrived, he was found dead. An autopsy was conducted, and he had some pneumonia symptoms in the lung, and after testing, the lung was tested positive by PCR. As for imported cases, among the 272 imported cases, 99 were confirmed at the airport, and then 90 cases were confirmed at the quarantine hotels and quarantine centers. The remaining 83 cases were confirmed from the samples of the community testing centers. Among the 83, 54 were samples taken on the 4th to the 7th days. The number after taking away from repositive cases in the 7th day accounted for about 20%, and that's similar to previous numbers. The remaining 29 cases at community centers were after the 7th day. The CT values were very high, and we believe they were repositive cases.
For importing countries, among the 272 cases, they came from 53 countries. 6 have imported more than 10 cases. Now, from India, the UK, Singapore, the Philippines, Thailand, and the US. The remaining 47 places have imported 10 or less cases to Hong Kong. For care homes, yesterday, we received cases from 11 care homes, 7 elderly care homes involving 10 residents, and 4 residential care homes for the disabled involving 3 residents and 2 staff members. In these 11 care homes, there were a total of 77 residents classified as close contacts, and quarantine is required. Now, for these 11 北保護老中心 in Kwun Tong, 1 resident confirmed. In Tuen Mun, Ming Ai, Lei Ka Shing Care and Attention Home, 2 residents confirmed. In Southern District, Gong An, Wu Lou Ji Ga, 1 resident confirmed. In Eastern District, Lok Yi, Wu Lei Zhong Sim, 1 resident confirmed. In the North District,香海正覺連社佛教保證安老院, 2 residents confirmed they are in the same room. In the Eastern District, Tonghua Group of Hospital, 方樹泉護理安老院, 1 resident confirmed. In Wan Chai, 松山府第老莊園, 2 residents confirmed. In Northern District, Hong Kong Spastic Association, Jockey Club, Bradbury, Hua Sim, Wuhong, Zhongsim, 2 staff members confirmed. Another one is RCED, Chengyi Characters, or Jockey Club, 1 resident. Wang Tai-Sin, Leimen Hui Cai Ma Ji Ga, 1 resident confirmed. And in Southern District, Tonghua Group of Hospitals, Jockey Club, 展成日間活動中心暨宿舍, 1 resident and 1 staff member confirmed. In the past 7 days, 45 care homes have reported new cases to you, involving 52 residents and 16 staff members. For schools, most schools are on holidays. This morning, we received 92 cases reported by schools, 71 involving students and 21 involving teaching staff. Among the schools, 61 are KGs, 6 primary schools, 3 secondary schools, and 1 special school. In the past 7 days, 8 schools have reported 2 or more cases. They are all KGs and CCCs. 1 school has to suspend 1 class. Tai Po Catholic St. Paul's Kindergarten in A1N class, there are 2 cases, and we have recommended that class be suspended for analysis of subvariant. According to samples done by our public laboratory, BA4 or 5, that is L452 out cases has risen to 24.5%, and the percentage of BA2 12.1, 8.9%. That ends my report. Allow me to supplement. With regard to the medical ward in Eastern Hospital, a male patient was confirmed when admitted on the 13th of August, and 5 more patients tested positive. Q&A, so please raise your hand. We'll pass you the microphone. Please identify yourself and also the organization you represent. The lady in the back row on the left. Good afternoon. I'm from Cable TV. What are the indicators for activating phase 3, and what should be the number of new cases before you activate phase 3, and what services would be affected? For BA4 or 5, now they are accounting for more cases in Hong Kong, and most of them are BA5. When do you expect it to be the prevalent strain in Hong Kong, and can we expect to see a cap? We have received complaints that somebody tested positive by RAT on Sunday, hasn't heard anything from you for 2 days. Is it because of a shortage of manpower? Some experts suggest that you can procure new vaccines from Paxlovid or from Moderna. Will you consider procuring a new type of vaccine? I'll take the first 3 questions, and Dr. Lau will take the first one. For subvariant BA4 or 5, a public health laboratory would randomly take samples from confirmed cases for L452R. If the result is positive, that means the case can be either BA4 or 5. And then we will take further samples to confirm whether it's BA4 or 5. We believe about 90% of L452R samples are BA5, meaning that the rise is mainly in BA5 cases. Globally, when BA5 becomes prevalent, then within a few weeks, it will continue to climb, and that will become the mainstream subvariant in the community because of its heightened transmissibility. We expect the same to happen in Hong Kong. And in the past few weeks, we've been seeing a more BA.5 or high proportion of L452R, and we believe this trend will continue. As regards when it will become the mainstream subvariant in Hong Kong, is hard to tell. According to WHO, about 60 to 7% of the COVID viruses in the world are BA.4 or 0.5. We expect the same. As for people tested positive through RAT, they have to make a declaration using the online platform. They must upload their ID cards and also the images of a positive result before the declaration is complete. And then the patient will receive an SMS automatically to receive an isolation order, and family members living together will receive a quarantine order. Perhaps there are people who have not completed the second stage. That is, they have not uploaded their ID cards or images of their RAT positive result. So if both steps are completed, we will issue an SMS and then follow up. As regards Moderna vaccines, so far we have not received any application from Moderna manufacturer. Now, under Cap 599K, the Secretary for Health can, based on an application from the supplier, manufacturer, importer of a vaccine, take into account the views of the vaccine expert committee and consider giving approval to a certain type of vaccine for designated purposes as a matter of emergency, and we will provide the necessary support.
As for the number of confirmed cases, we've seen that the number is increasing and number of admission is also increasing. In the past week, every day, new admissions exceeded 200 every day. Say, if you count the number of patients, say, for example, if they stay in the hospital for 8 days each, 8 times 200 will mean over 1,000 beds. About 200 to 300 patients per day. We may need to consider embarking on the third phase. More and more patients are remaining in the hospital. They occupy more and more beds. And we're worried that the number of new confirmed cases will continue to increase because we have seen that BA4 and BA5 are rising and they are very contagious. The number of confirmed cases are increasing and the number of admissions will also increase in tandem. So we need to prepare our third phase and reserve some more hospital beds. And then we have to adjust our service or even cut some of our service in order to have enough manpower to deal with new admissions suffering from COVID. Each cluster is monitoring their service and see what kind of services can be deferred. Say, for example, some X-ray or endoscopy procedures can be deferred if such not urgent. This is to reserve some manpower and hospital beds to deal with new admissions of COVID patients. Next, the lady sitting at the far right.
So, Dr. Lau, you have mentioned that when the pandemic worsens, non-emergency services will be affected. Can you give us more examples? And also, you have just mentioned that when daily hospitalizations reached like 200 to 300, the authorities will trigger the stage 3 hospital beds expansion plan. So can you explain the rationale behind again? And do you expect to trigger such plan in the coming week or two? Thank you.
We have observed that there are increasing number of confirmed cases in the community as well as confirmed cases admitted to the hospital. Because of the increasing proportion of BA.4 and BA.5, we expect that there will be increasing number of patients being diagnosed in the community as well as admitted to the hospital. It is a very simple calculation. When there is a 200 patients diagnosed and admitted to the hospital, when they stay for, say, 10 days, we need 2,000 beds. So we expect the number of admitted patients will be increasing. When it is near 300, we will expect 3,000 beds when they stay for 10 days. This is a simple calculation. Of course, we need to observe the actual or accurate number of days the patient stay in the hospital. So how can we arrange the best for the increasing number of patients admitted to the hospital? We have to readjust our services. We try to postpone some services that the patient may not be affected too much. For example, some elective surgery, some elective endoscopy, as well as some elective radiological examination. We have to maintain the emergency services. We have to maintain the services that the patient need must be timely managed. For example, trauma patient, accident patient, or some transplant patient, because the organ cannot be waited for a long time. So we have to maintain the emergency service. We have to maintain some essential service. So when we try to adjust the non-essential service, we aim to vacate more beds that can be available for the increasing number of confirmed cases who need to be admitted to the hospital. 下一位。
Next, the one sitting at the back on the left-hand side. Concerning the death cases, apart from the 96-year-old female who hadn't any vaccination, as for the remaining 3 who passed away, what were their vaccination records? As for the 88-year-old female, she had taken oral medication and the situation worsened. Why she passed away? As for the oncological ward in Chunmun Hospital, the staff member confirmed on the 11th of August what were the duties and responsibilities of the staff member. 76-year-old patient was critical. Another patient was also critical. How old was he or she? Or is he or she? As for the impact on children, BA.4 or BA.5, are they causing more serious illnesses among children? In answering your question, let me provide you with some supplementary information. A question from Cable. Someone tested positive, RAT positive, reported on the platform. They didn't receive any further context. Now we have 2 platforms. One is for RAT positive, www.gov.h/RAT. Another is www.chp.gov.hk/CDPI. If one is RAT positive and reported on the PCR platform, since we don't have the PCR positive record, we therefore will not automatically issue the quarantine order. Every day we receive CTPI 200 CTPI reports, which don't have any PCR record. They have made use of a wrong platform. So if you report RAT positive, you have to go to the RAT platform. Otherwise, there will be a delay. Another question is BA.4 or BA.5, if they become prevalent strain, what will the impact according to WHO? BA.4 or BA.5? In terms of the seriousness of the impact, there is no indication that they are raising the risk of deaths or serious illness. But the 2 strains are more contagious. If they become prevalent, then children will be affected. In Hong Kong, the vaccination rate of children is still low. For those below age 3, nearly all of them haven't had any vaccination. Now, with a more contagious strain, then the risk will be higher. For children, there may be more admissions into the hospital or even into the ICU wards. As for vaccination, the 96-year-old female didn't have any vaccination. The 60-year-old male who had cancer receiving chemo, he had 3 doses. As for the remaining 2, the 97-year-old male and the 88-year-old female had 2 doses each. So the vaccination wasn't complete. As for the, that's the point I want to make. The old lady was 88-year-old. She was chronically ill. She was tested RAT positive. And she went to a doctor and she was prescribed oral drug against COVID. Even if one has taken an oral drug against COVID, if one feels unwell, one should consult the doctor again. Some patients may say they have taken the oral drug and they, since they are on prescription, they may want to wait and see. The oral prescription might be able to deal with COVID, but they may have other complications leading to a worsening situation. So if they are admitted, we may give them remdesivir. So even if one is receiving an anti-COVID drug, if there's phlegm, shortness of breath, and other symptoms of coughing, they should go to the doctor.
Okay.
When it comes to the staff member, he is a ward assistant taking care of taking care of patients, to bath patients, change of diapers, etc. He's given full PPE. Now, I've only got 2 cases in Tum Mun Hospital, one critical and one serious in the clinical oncology department of Tum Mun Hospital. When I have further information, I can let you have it later. The lady on the right in white. Good afternoon. I'm from Mengpao. I'd like to follow up on the group case of the 2-year-old child. Do you know the subvariant it was carrying? And then the CEO of VICTRE, the chief executive of hospital authority, said that it's rather unscientific to when given the current definition of COVID death, will you readjust this definition? And we were told that after the 5th wave is over, we would have more statistics, death statistics. Will you have statistics of patients dying with and patients dying of COVID? Are you going to compile the statistics? All right, I will comment on death statistics. Now, every day we announce the new number of deaths, and they're announced in real time. When a patient passed away, and if he's been confirmed with COVID in the past 28 days, then we would classify it as a death tally probably related to COVID. Now, we cannot have a time lag, and we have to tell the number of deaths recently. But whether COVID-19 is an immediate cause or just due to complications caused by COVID, now this cannot be told at once. The relevant clinical doctor will have to make some further assessment. Perhaps the death certificate and the verdict by the coroner's court may be required to confirm the cause of death. So every day we are reporting preliminary death statistics so that members of the public can know, in the first instance, the number of deaths caused by COVID. To know the trend is important because this is an important indicator for us to tell the impact of COVID-19 on our healthcare system. HA colleagues and clinical medical practitioners will follow up and make an assessment afterwards to decide whether a patient died of or died with COVID. About 75% of the patients died with COVID. Let's see if Dr. Lau has anything to add. The case in PICU, I don't have information as to the subvariant is carrying. As for the cluster involving clinical oncology departments of Two Moon Hospital, I've just been told by my colleague that 2 are in critical condition, aged 76 and 84. And one that is, these 2 cases are serious. For the one who is in critical condition, 53 years old. We will have to consider circumstances surrounding a death, including the clinical history, the presenting symptoms, results of COVID tests, and also the death certificate, because the death certificate will carry the cause of death determined by the doctor at the point of death, and then we'll be able to know whether the case has died of COVID or died with COVID. You might have heard from us from time to time that we have referred a case to the coroner's court for an inquiry, because sometimes it's hard for the doctor to determine the cause of death in the first instance. A patient might have COVID, but he might have lung cancer and also hypertension, and it's hard to confirm the cause of death at once. For instance, a patient passed away very quickly, or may be found unconscious at home with no vital signs. So usually an autopsy is required to confirm the cause of death. Next. This report in blue.
BC. Could you give us the detailed figures on the total as well as the daily number of child infections and hospitalizations? And also, so far, what's the vaccination rate for those aged 6 months to 3 years old? And also regarding the cluster at the Two Moon Hospital, what's the vaccination status of the 9 COVID patients? Thank you.
I got the statistics of the 14th of August. We have admitted 22 patients under 3 years old, 17 patients from 3 to 11 years old, 3 patients from 12 to 19 years old, 30 patients from 20 to 59 years old, and 158 patients who are more than 60 years old. So we have observed that the number of patients who are admitted under 3 years old has some increasing trend, but of course not as much as the elderly. We saw that the elderly have increasing number of admission, but there's some increasing number of admissions for the children. Sorry, I haven't any statistics about the vaccinations of the patients who are admitted. But I want to take this chance to encourage and appeal to the public that please bring your children to take the vaccinations as soon as possible, because we have observed increasing number of admissions of the children, as well as increasing number of serious as well as critical cases in the children because of the COVID-19 infection. The pediatricians told us that there are much protections against COVID-19 after vaccinations in children under 3 years old or over 3 years old, of all the children. So because of the newly relaxations of the injection of vaccinations criteria, any children who are aged 6 months or above can have the injections of COVID-19. It's better to have three injections, and you take 4 months, as well as mentioned by Professor Low yesterday. We have to bought time at this moment to vaccinate our children, as we are expecting that there may be another increasing surge of COVID-19 cases during the winter.
And maybe I supplement some information on the number of pediatric infections. In the past, from the 1st of August to the 14th of August, we recorded a total of 1,130 cases affecting children aged below 3 years, which constitute about 1.8% of the total number of cases reported in these 2 weeks, as compared with 874 pediatric cases aged 0 to 2 years old in the previous 2 weeks, from 18th of July to 31st of July. So there is a significant increase in the absolute number of cases affecting very young children. For children aged 3 to 9, the total number in the past 2 weeks is 3,483 cases, which constitute about 5.5% of the total number of cases reported in these 2 weeks, as compared with 3,263 cases affecting children aged 3 to 9 years in the previous 2 weeks, also constituting 5.5% of the total number of cases in the previous 2 weeks.
Oh, sorry, I have not heard this information at this moment.
我哋答得最後一位右手。
The last question, the one on the right-hand side. I'm from AM 730. The initial analysis, 70% die with COVID. What about the remaining 30%? And what is the cutoff date for this number? Would it be just preliminary until COVID has left us? And what is the reason for making the decision today concerning prescription of COVID drug? And it is said that even if one is prescribed COVID drugs, one should continue to seek medical help if one have the symptoms. So what are the symptoms that would warrant seeking further medical help? As for clinical analysis, the HA colleague will consider each case, including the case history, and also the autopsy result, and also the assessment of the coroner in deciding whether a case is die with or die of COVID. It takes time, and one has to get the death certificate in order to confirm that. I don't know whether Dr. Lau has anything to add. I don't have the numbers in hand. About 60 to 70% will die with COVID. Some cases have to be, say, about 10% will have to be decided by the coroner's court. We cannot give you the number because the number is very fluid. Every day there may be new cases, and those patients die with COVID or die of COVID. We need more information. Roughly speaking, about 60 to 70% died had confirmed COVID record in the past 28 days. As for oral prescription or the oral drug, we refer to international medical literature. The elderly people may not be able to express themselves fully on their own condition, but they just feel that for decades they have been coughing. And they don't treat that seriously. We follow international practice, and then for those age 60 or above, if they come to us, come to our clinic or through medical examination, if they are confirmed COVID, we will prescribe oral drug against COVID, because the drug will reduce the loading of the virus, and that may help to reduce the number of deaths. Sorry, what was the third question? Yes. Now, the symptoms have been there. Say, I have been coughing all the time. Now, after taking the oral drug, you feel that it is just like what I used to have in terms of coughing. But after that, if you have a headache, you have fever, the blood oxygen level is low, then you should go to the doctor. Now, when the doctor examined you and had your medical history checked, that was the situation then. But if you have, say, a worsening situation, you feel more fatigue, you lost appetite, you say like energy, and you drink less water, the situation may get worse. And when your family members find that you are very ill and bring you to the A&E department, usually we find the patient is dehydrated. And then if the dehydration may lead to poorer kidney conditions. So if one has COVID, one should maintain one's appetite, maintain and ensure adequate water intake, fully hydrated. If one is admitted, we will first administer saline in order to keep the patient hydrated. Yes, this is the end of the press conference. Thank you very much. Sorry, speaker is not coming through. About 70% of the deaths were related to COVID infection. The remaining 30 may not be directly related. Let's don't use die off or die with. Now, from the medical history, from the examination results, we consider that COVID has caused the death, or the death is related to COVID. The patient, as for other deaths, the patient died of other cases.